Aaron with Altitude Physical Therapy and just wanted to show you what it's like from the patient's perspective for a telehealth visit. So I'm in my dashboard right now. What you can see is I have a link here into the Altitude Physical Therapy where it says 4 people are on duty, which is also linked into here. So what I'm going to do is I'm going to click onto this guy. And Lisa should, this little thing is telling me that she's not quite on duty yet, but she is in typing. And so it's going to go, "Hi Aaron, are you ready for your session?" Yep, let's do this. And so she's going to then send me a link to join the visit. Once we're in, this is what it's going to look like. And soon I'll get a little link that says join video. So Lisa's the one that initiates this.
Hi, Aaron.
Hey, Lisa, how are you?
Good, how are you?
Doing well.
Good, so we're doing this video as a demonstration for our future patients, current patients who are dealing with the COVID-19 pandemic and staying inside and staying safe. We want to offer our expertise to you and show you that telemedicine is a very viable way for us to treat you and help you get to your road to recovery sooner. So I am going to be a physical therapist and Aaron is going to be patient. Aaron has told me that he has low back pain, and we've already gone through his history, since that's pretty easy for you guys to see that we can communicate very easily through this platform. So the next thing I'm going to do is I'm going to ask Aaron to go ahead and move his laptop to somewhere where I can see his full body. This platform works best if the patient is using a laptop, same with the therapist, because we do a lot of demonstration, and we'll ask you to get on and off the floor. And then the next thing that I'll do is I'm going to show Aaron what I want him to do also by backing up and saying, "Aaron, can you go ahead and put your hands right on your waist here?" Good. Go ahead and put your feet together for me and see if your hands are pretty level. Excellent. Now I want you to go ahead and turn to the left for me, and I want you to bend forward and try to touch your toes. Good. And then come on back up. Go ahead and raise your arms overhead and lean backward. Good. And then back. And then go ahead and face me again. And can you slide your right arm down your leg? Very good. And your left arm down your leg? Excellent. And then can you rotate like you're going to look out that beautiful window behind you? Good. And then rotate the other way. Great. Any pain with any of that?
A little bit of pain in my lower left back.
Okay. Go ahead for me, Aaron. Can you walk in place on your toes? I can see your feet right now, so we'll just go ahead and do that. Good. And then can you walk on your heels? Excellent. Can you balance on your right leg? Good. And can you balance on your left leg? Excellent. Go ahead and put your feet shoulder width apart for me, and I want you to squat 3 times. Good. Excellent, good. And then go ahead and turn around for me. Put your hands on your waist and do the same thing. Good. And so what I'm seeing here as another physical therapist would see is Aaron's kind of dipping and avoiding his left hip for some reason. You can see his shoulders dipping a little bit. Go ahead, Aaron, now, and can you tilt the laptop down so that I can see the floor? I'm going to have you get on the floor and do a few things for me. You can either get on the floor, kind of like pencil right in front of me, or sideways is fine. Can you hug your right knee to your chest? Good. And does that hurt at all?
Nope.
Can you bring that knee a little bit to your left shoulder? And does that hurt or pinch at all?
Feel a little bit of a pull coming right through here.
Okay. And then can you put your right ankle on top of your left thigh for me and kind of make a little figure 4? Just let that knee drop all the way down to the side. Any pain with that?
Just some pulling.
Okay, and then go ahead and extend that right leg straight and lift it straight in the air for me. Any pain with that?
Just some pulling behind the leg.
Okay, go ahead and hug your left knee now to your chest. Give a hug, yep. Good. So I can tell, even in this view, that leg is not going near as far as his other one did. Can you bring it across towards your right shoulder and tell me how that feels?
Getting some pinch kind of coming down to the groin.
Yeah. Not a lot of movement seen on that one. Go ahead and put that ankle on top of the thigh, just like the other side, making that figure 4. Let that knee drop. Good, so a little limitation there as well. So definitely something going on in his left hip. Go ahead and drop that left leg straight for me and lift it straight in the air. Good, and then back down. Any pain with that?
Just some pulling behind the leg.
Great. Aaron, you can go ahead and sit up and just face the camera for me. So what I would do now as Aaron's physical therapist is I would probably give him a few exercises, including stretches for this left hip because I know he's avoiding it. And I would give him some unilateral or single leg strengthening because I can tell from his squat that he's not using his legs evenly. And sometimes what we do through telemedicine is we use that also diagnostically, giving him a challenge or a stretch and say, does that feel the same as it does on the other side? And that's how we would begin and initiate your rehab through telemedicine. Aaron, is there anything else you'd like to add?
No, I think we covered that. If you have any equipment that is beneficial for exercise, having that readily available always helps.
All right, everyone, thanks for listening, and I hope this helps you see how we can help you through telemedicine.
Awesome. Thanks, everybody.